I would say the other thing, and it's, I mean, it's something you very intentionally we did here, is hiring. We need, I mean, for example, I mean, the unemployment rate for trans people is incredibly high. And a lot of those are very qualified people who've had huge things they've accomplished and done in their lives, and we're wasting their talents. And so having those people in, not, I mean, in primary care offices, everywhere from the front desk to nursing, to the provider who sees them, to an administrator who walks through, is really important, because with any implicit bias, it's harder to hold on to your biases tightly when you look people in the eyes and you talk to them on a regular basis. And so I think that is really important, is bringing more people into the system, making sure they have opportunities, and to, you know, if we bring someone in here at an entry-level trainee job and our goal is, well, eventually we want to see you as a nurse or as a, you know, a accountant who's keeping the books, or, you know, whatever it is that you're interested in, we can help you grow there. And if everyone did that with all their implicit biases, we could see just transformation. The other challenge I have had, so cisgender white man here, is admitting that I do have those biases and seeing them. And you're taught a lot in med school about what you're good at, and you've been very good at a lot of things through your life, and we are very smart people. We are doing the best we can almost all the time. But realizing that this is an area that we probably weren't taught about, we probably don't know about. And so we've educated ourselves about, you know, the newest thing in treating hypertension. We can educate ourselves in this and incorporate it very well. There are stereotypes of every field. And I mean, I can tell you, like, we recently met with a plastic surgeon here in town who, she's amazing. She's talking about bias against people because of their weight, and about bias against people for all sorts of different things that she tries to work through to expand who she can do surgery for, rather than limiting it based on things that don't make a lot of sense in medicine. Because a lot of what we were taught turns out to perhaps not have been as true as we thought it was, which is what science is. Science keeps learning new things. And so now that we're seeing it, we're like, okay, this is a problem. We need to fix this and work on it. And who better than primary care providers? Who better than doctors to work on it?
I would also say, you know, Harvard Medical School has done a great job with this, with their sexual and gender minority health curriculum, baking in sexual and gender minority health throughout the curriculum, right? It's not the one case study that is, you know, a queer man. It's many of them baked in throughout all of this, right? And that normalizes the fact that sexual and gender diversity is just a fact of humanity. We're seeing more and more people come out as trans, non-binary, you know, gay, lesbian, bi, and lots of people on different sides of the Kinsey scale. And so with that, it means that, you know, this is recognizing the multiple layers that exist for any one person, right? And in seeing the whole layers of who they are, that allows us to be a little less biased, right? To understand that each person has depth to them, that they can't necessarily just be categorized into one space or another. And hopefully the breakdown of those categories leads to less grouping and less bias.